everybody, my pathology presentation is on renal artery stenosis. And renal artery stenosis is a narrowing of one or more arteries that carries blood to the kidneys. The narrowing of the arteries prevents normal amounts of oxygen-rich blood from reaching your kidneys, and your kidneys need adequate blood flow to help filter waste products and remove excessive fluid. And reduced blood flow may increase blood pressure in your whole body and injure that tissue from your kidneys. I'm going to start off with some normal anatomy. Renal arteries are the vessels that supply blood to the kidney by branching off the abdominal aorta and course laterally to the prospective kidney. The normal measurements of the renal artery are 0.4 to 0.5 centimeters. Kidneys are a low-resistant organ and demand constant blood flow to moderate their metabolic activity. Hemodynamic flow patterns in normal renal arteries supplying non-diseased kidneys demonstrate high diastolic flow. This is the image of a normal Doppler of the renal arteries. Sonographically, the renal arteries have an echo-free extra lumen with high echogenic borders. They lie posterior to the veins and can be demonstrated if their junction with the aorta is seen. With pathology, in patients with chronic disease, the vascular resistance of the kidney increases. This increase in renovascular resistance of the end organ may be expressed in flow patterns from the renal artery as a decrease in the diastolic flow component. This is the image of renal artery stenosis with the Doppler on it. RAS is the most common correctable cause of hypertension. Only 1% to 5% of hypertensive patients have renovascular origin, and most patients have the essential hypertension. Some symptoms: renal artery stenosis may cause no signs or symptoms until the condition reaches an advanced state. The condition may be discovered incidentally during testing for some other reason. Your doctor may suspect a problem if the patient has high blood pressure that begins suddenly, or high blood pressure that begins before age 30 or after age 55. As renal artery stenosis progresses, other signs and symptoms may include high blood pressure that's difficult to treat, a bruit, which is a whooshing sound as blood flows through a narrow vessel, elevated protein levels in the urine, or other signs of abnormal kidney function. There are two main causes of renal artery stenosis, and that includes arterial sclerosis of the renal arteries and fibromuscular dysplasia. Arterial sclerosis is a buildup of fats, cholesterol, and other substances in and on your artery walls. As the deposit gets larger, they can harden, reduce blood flow, cause scarring of the kidney, and eventually narrow of the artery can result. Arteriosclerosis is associated with hypertension, which is more common in older patients and accounts for 1/3 of cases, and it is more frequently found in males. This usually occurs within the first 2 centimeters of the renal artery, and it may be multifocal or in both arteries. With fibromuscular dysplasia, the muscle of the artery wall grows abnormally. The renal artery can have normal sections alternating with wider artery sections, giving a bead-like appearance in the image. The renal artery can narrow so much that the kidney doesn't receive an adequate supply of blood and can become damaged. Fibromuscular dysplasia accounts for 2/3 of RAS cases and is seen more frequently in younger patients. This may involve any layer of the renal artery wall and is classified as intimal, medial, or advential. The stenosis is smooth and usually in the mid-portion of the renal artery. Involvement of the medial layer is the most common subtype, and it accounts for more than 90% of all renal artery stenosis cases. So some sonographic characteristics of RAS is when one kidney is smaller than the contralateral side, absence of an early systolic peak, overall waveform shape is tardus parvus, which describes the decreased acceleration time and the decreased peak, and a delayed systolic rise time. The gold standard for visualizing RAS is selective renal arteriography, but Doppler ultrasound is used to diagnose renal artery stenosis along with CT, MRA, and renal arteriography. Some sonographic findings are increased velocity through the stenotic area greater than 150 to 190 centimeters per second, and turbulence distal to the narrowing. Treatments for RAS include blood pressure medication and other medication to control other cardiovascular risk, lifestyle changes such as eating healthy, more exercise, and no smoking, and there are surgeries to correct RAS such as renal angioplasty and stenting, renal artery bypass, or renal endarterectomy. And that concludes my pathology presentation on renal artery stenosis.